From the moment they are born, there is something very special about their presence. From their tiny toes to their delicate fingers, babies have the ability to melt your heart. As a parent, you immediately begin to think about the future with your new baby. Holidays and first steps, school plays and sports. Your mind races with all the wonderful things you're about to experience. But one thing most new parents don't think much about when they're planning to bring home their new bundle of joy is the thing babies do most of the time: crying. Crying is one of the things about babies that is hard to figure out, and it can frustrate any parent.
It's absolutely normal for a baby to cry. It's how they communicate their needs, and it's not in any way an expression of anger. Just knowing that the crying is normal and that they shouldn't take it personally, I think is one of the first things.
Babies cry for all kinds of reasons. They're hot, they're cold, they're wet, they're hungry, they're bored.
Sadly, not everyone copes with crying in the same way. It takes a lot of patience and understanding when babies cry, and even more patience when babies cry for a long period of time.
Having my first child was extremely scary. Starting at the hospital, it amazes me that you have all this help for 2 to 3 days, you have nurses there, and then all of a sudden you just go home and you're totally on your own. It was a total 180 on my husband and I. We just had no idea what we were doing. It was so scary.
I've been around children all my life, and then I became a pediatrician, and so I take care of kids all the time. But 15 months ago, I had my first child, and I was lucky enough to have twins. And it has been a very eye-opening and humbling experience. And just making it to a doctor's appointment's a miracle. And sometimes you lose your mind, and that's normal. And sometimes the easiest things can seem like the hardest.
Crying can trigger anger and frustration, and it is the number one reason given when child abuse occurs. To those who cannot control the frustration of a crying infant, harm can come to a baby. Innocent babies suffer due to what is known as shaken baby syndrome. A moment's loss of control can change a life forever. When a baby is shaken, even for just a few moments, the head whips violently back and forth and side to side, causing damage to the brain as it shifts inside the skull cavity. Blood vessels tear. Bleeding occurs inside the brain and on its surface. Brain tissue can be stretched and distorted. The harm that comes during a shaking incident has devastating effects on the baby's brain. The brain is the control center for all body's functions. The brain controls all thinking functions, such as emotions, behavior, memories, learning, and intelligence. The brain is responsible for the ability to walk, talk, taste, smell, and see. The two most important functions controlled by the brain are breathing and heart rate. Injuries that can occur from just one shaking episode include blindness, seizures, brain damage, learning disabilities, spinal cord injury, paralysis, and even death.
When a baby is shaken, they can become limp. They can stop breathing. It doesn't take long for their heart to stop beating. In some cases, their brain swells so much that it actually causes damage to the brain afterward.
It is difficult to understand how anyone could do this to an innocent child, but the fact is, anyone can get frustrated with a baby's cry. Anyone has the potential to lose control, and it takes just that one moment to change a lifetime.
People who are easily frustrated with children, people who commit domestic violence, suffer from drug abuse, but some are just parents that have reached their anger. They've reached a point where they cannot stop and control their anger. It doesn't matter what socioeconomic class you come from. you can lose your cool with a child.
I'm Dr. Mike Nethers. I'm a board-certified OBGYN and have practiced in Elizabethtown, Kentucky for 20 years. And my granddaughter died as a result of shaken baby syndrome. My wife and I have 5 children. The youngest one at home currently with us at the time was a junior in high school. She was 16 and got pregnant. He was older, about 20 years old at the time, I think. And our daughter was 16-year-old deeply in love at that time, so he hung the moon for her. At about 28 weeks gestation, she was in a pretty significant car wreck. 3 days later, she went back to work and school and continued to do so until about 32 weeks gestation, when she went into preterm labor and delivered little Alea on August 8th at 2 pounds and 14 ounces. After about a week, the father of the baby pretty much demanded that he get the baby. He was a father. They had talked to the doctors. He had passed all the CPR courses. And despite our objection, with me being a physician, my wife being a nurse, we thought that it was better for a preterm baby on an apnea monitor probably to stay with us than go to his grandma's or wherever he was to stay. But he was pretty forceful, and Mackenzie sided with him as her boyfriend slash fiance slash father of the baby, and she was doing everything she could to keep that family unit together.
The baby had stayed with her father the night before. She went over to visit that morning before she went to school. And she went in to give her a kiss and to tell her, good morning before she went to school. And she said she wouldn't wake up. She wasn't responsive. And after, I guess, trying to feed her, trying to get her to wake up, she called me. And she said, Mom, something's not right. Alea won't wake up. And so she called me and she said she's moaning and I can't get her to wake up. And I said, did you try to feed her? And she said, yes. She said, I'm tapping her foot. She won't wake up. And I could hear the baby moaning through the phone. And I told her to bring her to me right away.
When Mackenzie brought Alea over, it was very obvious that something bad was going on.
They took her from me, and they looked at her eyes. Her pupils were dilated, and they were, she was not responding. So I immediately called 911, and the ambulance got right there.
Once at the hospital, they did a great job, worked on getting IVs in, supported her with oxygen, and sent her down for a CAT scan, CT scan of the head. And I could see the images when they started to come up. I knew right then that she was going to die. I didn't pass that on to anybody, but I'm maybe an OBGYN, but I know what a brain's supposed to look like on a CT scan. And there wasn't a brain. There was not white matter, gray matter. It looked like what we call ground glass appearance. It looked like mush. I think it's really important to stress the support system that a family has. You've got to have somewhere to go, someone to talk to, somebody to help with that time out that you need to get away from the baby and have the baby taken care of while you regroup. I think some of the problem in our situation was that the baby's father might not have been such a bad father when he had other people around. But about 3 or 4 weeks before all this happened, he got his own apartment, And I think he just didn't have the coping mechanisms or the social support to help him when he got frustrated, and he took it out on Alea.
Be very careful. I'm the cow. Is anyone coming? Look both ways.
I really didn't know too much when I first got there. They just told me he was beaten really bad, and they suspected it was my ex-boyfriend who was watching him. He had suffered a fractured skull, a lacerated liver. He had a few fractured ribs. He had bruises all over his body. He had severe swelling of the brain. He had a lot going on. He got frustrated with Cornell. He was crying, and he first threw him in his baby bed, and I believe that's what fractured his skull. He was pretty bad off. They didn't think he was gonna make it out of the hospital. His long-term effects, he will have a G-tube until he's able to eat again. He has a shunt that drains fluid off his brain, and that's something he'll have for life. He has to start walking all over again, talking, remembering people, faces, places, and things. I felt anger, I felt sadness, I blamed myself. I kind of went through all the emotions there is. But if Cornell could understand me right now, I would tell him I'm sorry that he had to go through this. I would tell him I love him, and I will protect him with all my everything. I will always love him.
Child abuse is 100% preventable. And as a parent, it is your job to protect your baby from abuse. While it's a certainty that your baby will cry and that you will feel some unintended frustration as a new parent, there are several ways you can protect your baby, even in those moments when you lose your cool. When your baby cries, try soothing them. Feeding, changing, or burping your baby may accomplish this. Babies are also oftentimes comforted by rocking, singing, soft music, white noise, or just being swaddled. If you feel yourself becoming frustrated, soothe yourself before you attempt to soothe a baby. Take a deep breath. Count backwards from 10. Listen to music. Call a friend. Never, never handle a baby when you are frustrated, angry, or upset.
I think as a new mom, and as many parents do, you struggle with ways to comfort your baby during those difficult times when they're upset. And I think that it's a problem, and I see why it is a problem, but you have to find other solutions besides shaking the baby.
Know that there are times when the baby may not stop crying. For these times, have a plan. If you cannot control your frustrations, call someone to help or relieve you. If you do not have available support, place your baby alone on his or her back in his or her crib and walk away for a minute or two.
Understanding that it is okay to walk away and take a break. If you're caring for a baby, allowing that baby to cry in his or her crib is perfectly okay, so that you can walk out of the room, even out on the front porch, and take a break or take a breather if you need to help calm down. Crying doesn't hurt babies, but shaking will.
One of the most important decisions parents make is who will watch and care for their baby. Choose someone you trust. Choose someone who will put your child's needs first. Choose someone who is calm and patient. Do not let your child be watched or cared for by anyone who you do not trust, you have an uneasy feeling about, has a temper, uses drugs or alcohol, gets frustrated by crying, messes, spills, or other normal behavior. Teach the person watching your baby all that you have learned about crying. As you leave, it is important to make sure that the person watching your baby knows how to get in touch with you or another person who is willing to come right away should things get out of hand. Make sure you have given tips on how to soothe a crying infant. Make sure you teach the person watching your baby how to calm themselves during crying episodes. If the crying continues, give instructions to lay the baby down, alone, on his or her back, in the crib, and to give you a call. Remember, it's okay to step away. No child ever deserves to be abused. What they do deserve is to be in a warm and caring environment, feeling loved and safe. We all play a role in protecting the most vulnerable of all citizens. Protecting a child from harm means that abuse will be eliminated. Protecting a child from harm ensures a bright future. Protecting a child from harm gives all of us hope for tomorrow.